Welcome to the Brownfield Trade Talk Showcase. I'm anchor reporter Megan Grebner. With us is Paul Sundberg with the Swine Health Information Center. Good morning.
Good morning, Megan. It's good to be with you.
Good to be with you too. Really a couple of great topics we're going to focus on today. African swine fever, we'll start there, is probably one of the things that the pork industry continues to monitor closely and one of the biggest concerns. Let's talk a little bit about a project that you have or that's going on with you and the Foreign Ag Service from USDA.
Sure. So first of all, with African swine fever, always start with it's not a foodborne issue. It's an infection only for pigs. Doesn't affect people at all. And everybody's focused on prevention, and that is absolutely the number one priority. We need to keep this virus out of the North American continent, let alone the U.S. But the one thing that we learned from the porcine epidemic diarrhea outbreak in 2013, which was PED back then, was that we have to be prepared. We had to do a lot of quick research to learn about that virus on the run as it was going through our pigs and as we were having that outbreak. And that was a lesson in preparedness for us. And so what we've been able to do is get a grant from the USDA Foreign Ag Service. And with that, $1.7 million over 2 years. And with that grant, to look at African swine fever and the outbreak as it's happening in Vietnam. Two pieces of this. And one piece is educational materials and seminars and those types of things for the Vietnamese government, for the Vietnamese veterinarians and producers, and having those done in Vietnam. The University of Minnesota is coordinating that. But the second piece is the exciting piece for me that I really am looking forward to the results, because that is applying what we need to know in response to African swine fever, should it get here, before it gets here. We're looking at a lot of different things that we have to figure out about how to manage it, how to control it, how to respond to it. And it's an opportunity to do that during a real outbreak rather than in a laboratory somewhere where you can only work with 5 or 10 or 20 pigs at a time.
What are you hoping to take from this research, and how does it benefit pork producers here at home? We know we want to keep it out of the U.S., but is it helping with formulate reaction, control, containment, eradication, those types of steps to figure it out if it would happen to make it here in the U.S.?
Yeah, all that type of thing. So for example, one example is, what do we do for surveillance? If it's here in the U.S., we know we're going to have an eradication program, and we know we've got to know where it is, and we know we have to have samples that we can use during any program for surveillance that are reliable, are timely, and can be done quickly on the farm. So we're looking at, for example, the use of oral fluids, swine oral fluids. We use that for diagnostics in the country right now for PRRS and a variety, mycoplasma, a variety of different things. And we send in oral fluids in the veterinary diagnostic labs to test both for antigen, both for the presence of viruses, as well as for the presence of antibodies. And we're looking at the ability to use oral fluids for African swine fever in a surveillance program. That's a cooperative effort with the Canadian Food Inspection Agency, the CFIA, and USDA on Plum Island, our USDA Agricultural Research Service. So we've got those folks working together with us to look at oral fluids. There are a number of other things. Management. We are investigating different ways to manage infections as well. An example is we're looking at sensitivity and specificity of penside tests. So where we get into an eradication program, or where we get into when the virus is endemic in the US, there are different management things that we may have to have happen. And in those management things, we may not have time to send samples into a veterinary diagnostic lab. And so we're looking at penside tests so we can identify the viruses real time on the farm. Another management thing is looking to see how we can quickly identify infection in individually housed animals, for example, in a gestation barn or a farrowing barn, identify infection in those individually housed animals and be able to extract those animals and the infection from the barn without getting infection in the rest of the barn. When we get into a program where we've got to manage African swine fever, then, for example, if we have 4 barns on a site, right now our policy is you get infection in one of those barns, all 4 barns have to be depopulated. Well, if we can manage it such that we can quickly extract that virus from even within one barn, we can save the production in the other barns. So what we're trying to do in Vietnam is do real world types of scenarios, looking way down the line to try to predict and try to think about what happens if, and what lessons can we learn from Vietnam as that virus is going through the country and they're actually having the outbreak.
It really pairs well with the mission of the Swine Health Information Center overall, which is to protect and enhance health of the United States swine herd. But you're also doing some research here at home. Talk to me about that project and how exciting that is for the center, but also for pork producers and the pork industry as well.
Yeah, I think that we've got an effort going with the University of Minnesota and North Carolina State University in tandem. Different projects, but really synergistic projects that are looking at how we can take advantage of producers willing to share information, willing to share status, health status, willing to share information about their farms, willing to share information about where they're located and characteristics of their farms, and use that information to actually predict outbreaks of disease. We're focused right now on PED, and we're at the point where using both those projects and looking at it together in different areas of the country with different weather patterns, different topography, different production, we are on the cusp of being able to predict 2 weeks ahead of time if a farm is going to outbreak with PED, for example. That gives that producer, that farm, the ability to say, uh-oh, something's going to happen. What do we need to do about it? We need to increase biosecurity. Do we need to do something different? How are we doing it? Look at our system, try to prevent it. Maybe it's a matter of managing, and if we've got pigs that are scheduled to be weaned in another 2 weeks or another 3 weeks, maybe we wean them early to make sure that we do the best we can do to prevent anything from happening on the farm and causing an economic consequence. So we aren't quite there with 100% surety yet, but we're doing pretty well. And we're getting to the spot where when producers are willing to share that information, which was a really important outcome of the PED outbreak, that really kind of opened up people to talking about disease and outbreaks and the Swine Health Information Center. And we're able to use that data, and we're going to be able to predict disease. Think about that, being able to predict it before it gets there. I spent my whole career chasing disease, and now we have a possibility we can get in front of it.
And not only from a control aspect, but the financial implications that has for producers as well, to protect their animals and their herd, but their profitability.
That's absolutely right. This is all about profitability. It's all about the opportunity for profitability, its economic return. And if we can help with giving some information about disease status and disease biosecurity, and maybe extend that from PED to PRRS, for example, we're still working on that. We don't have that one perfected yet, but we're working on that. Next step, I'm really looking forward to being able to help with predicting PRRS outbreaks, because that's our number one issue, and that's going to go a long way to that profitability issue.
Dr. Sundberg, the work that the Swine Health Information Center is doing is fascinating. If folks want to find out more information and to see what you guys are up to, how can they do so?
Sure. The best way, the easiest way is swinehealth.org on the website. At swinehealth.org, they can see all of the materials and all of the research and everything we've got. It's pretty succinct, so it's easy to go through. The other thing, though, that people can do is sign up for a newsletter, for example. It's not an intrusive thing. It's a once a month newsletter that comes into your inbox that gives updates on different projects. It gives updates on the disease status in the US. We have a system for monitoring disease status in the US. We have a system for monitoring disease status around the world and reporting on that. So not only does it report on projects, but it also gives both US and world information about swine health and swine diseases. Easy spot to sign up, easy thing to do, and I'd encourage everybody to go to swinehealth.org.
Dr. Paul Sundberg, thank you so much for your time. Good to see you.
It's good to see you too, Megan. Thanks for the opportunity.
I'm Megan Grebner for Brownfield.